And I will like to give a warm welcome to our speakers in order of appearance. Today we have Jason Gerson, who is the Senior Program Officer of Clinical Effectiveness and Decision Science, and Donna Dentry, Assistant Director of Contract and Management Program Support at PCORI. Representing ICPSR today will be Amy Pienta, Research Scientist and the Project Director of PCODR, and myself, Kirani Renault, Data Project Manager for the repository. In today's webinar, you will learn about PCORI's policy for data management and data sharing, the contractual components involved, as well as the repository's uniqueness. After that, we will walk you through the deposit process and finally answer any questions you might have. Jason, the floor is yours.
Hey, thank you, Kirani. So as Kirani said, I'm Jason Gerson. I'm a Senior Program Officer at PCORI and have been responsible for, with others, for the development and now implementation of PCORI's policy on data management and data sharing. So my role here is to provide a brief overview of the policy and some of its core features before turning it over to my colleague Donna, and then subsequent to that to the ICPSR folks. So the policy on data management and data sharing was approved by PCORI's Board of Governors in September of 2018. Some of our core guiding values statement principles include that treating the PCORI funded data and data set and data documentation as a scientific asset, the utility of which should be maximized. And the ultimate goal is to encourage the scientifically rigorous secondary use of clinical research data that PCORI funds in support of ultimately improving population, patient and population health. And so the core goal of underlying the policy and the activity is to really systematically create and preserve research data and data documentation, which will reside at the ICPSR repository that we've created, which is called the Patient-Centered Outcomes Data Repository. So next slide, please. So some core features of the policy. Some of you attending the webinar may be familiar with this, but I think it's useful to highlight. So at its core of the policy, at the outset, we articulate PCORI's expectations for data management and data sharing to our research awardees. The policy specifies the data and the data documentation to be shared. Importantly, PCORI provides funding to support our research awardees' time and effort to prepare the data. It specifies when the data would be made available for third-party requests, describes the data request review process, and articulates criteria in the review process regarding exemptions from the policy requirements. Next slide, please. So I'm going to drill down a little bit on some of the features. We'll start with the data deposition. So first and foremost, the data that is to be deposited in the ICPSR repository will be de-identified data in accordance with the HIPAA privacy rule. PCORI thinks of the data and data documentation as a full data package. This follows a 2015 or 2016 IOM report. So where we think about not just the data set, but the constellation of data documents that surround that data set. So this includes obviously the analyzable data set, the full protocol, metadata, data dictionary, analytic plan, and analytic code. We are mindful of the fact that the data that is deposited in the repository conforms with informed consent, particular to those studies, and that that it allows for research purposes, secondary research purposes, and we will work closely with you, the awardees, to ensure that your consent processes are developed in accordance with the policy and PCORI's expectations. Some of you on this webinar may be PCORNet researchers or working on PCORNet projects. Obviously, the nature of PCORNet research and distributed data networks implies that there'll be a kind of a slightly analogous but distinct set of products and documents that get deposited in the repository. These are specified in the policy and are highlighted in the bullets on this slide. I won't read through it, but you have it, and the policy makes clear on what these are, and I'm happy to take questions specific to this if they arise. Next slide, please. So a little bit more about the data deposition process. So once we've spoken with you and you're going forward with the data deposition, we'll facilitate a conversation with ICPSR to begin that curation process. I'll rely on Donna to describe the contractual mechanisms through which that would happen. The data will ultimately be hosted by ICPSR and not PCORI. PCORI as a funder is not in a position where we want to be holding that data. So the relationship with ICPSR was to create a structure and a partnership through which the data can be deposited and accessed through a request process. And those of you who will work with ICPSR, you'll enter into a data contributor agreement or a DCA with ICPSR. This data contributor agreement is the kind of the core governance document for you as the data generator or contributor, and it governs the data deposition and establishes your rights and obligations. Next slide, please. So I'll say a few words about the time frame for data availability. PCORI, in the development of the policy, we thought long and hard about the time frame through which data would be made available, and mindful of both PCORI's kind of statutory requirements with respect to making and having you develop and then ultimately posting that final research report, and your need and desire to publish papers in peer-reviewed journals. So where we landed is that the data, you will go through the process with ICPSR, the data will get curated, and then the timing at which that data will be posted will be as the slide describes. So it'll be triggered by one of two things. Either the final research report is posted and made available on PCORI's website, or you and your collaborators on the research team have published primary results in a peer-reviewed journal, whichever comes first. So the idea there is that there may be delays with the finalization of your final research report and the posting, and we didn't want to delay the availability of the data that's available at the repository to a period far out. But we recognize that you will be motivated to get your primary results that's in peer-reviewed journals. So we will work with you closely at a project-specific level to figure out what those dates are, and we'll communicate that to ICPSR, so everybody is working from the same playbook. Next slide, please. So I'll say a few words about the data request review process. So at the time of the policy's development, there were a number of conversations about where the bar should be set in terms of what constitutes an appropriate request for the data. And so here you see some bullets that describe where we landed. So any request in order to be approved will be evaluated for a scientific purpose that is clearly described, that a statement or kind of a demonstrable, a demonstration that the data requested will be used to develop or contribute to generalizable knowledge, that the proposed research can be reasonably addressed using the requested data, that the requester team has the appropriate expertise to conduct the proposed research, that questions and outcomes being described in the proposal or in the request are relevant to patients. And then there will be, the policy calls for a very clear prohibitions against re-identification of individuals and redistribution of the data. So, you'll have to make a statement to that effect in the request. And then approved requesters, analogous to a data contributor agreement, they'll enter into a data use agreement with ICPSR. This data use agreement, or DUA, specifies the terms and conditions of data use, as well as the responsibilities and obligations of the data requester. So the data use agreement, like the data contributor agreement, is kind of a core governance document for data sharing. They're in place in many settings you may have be party to data use agreements in your other research activities. So so approved requesters for these for the PCORI funded data will be obligated to sign this DUA and adhere to it. Next slide, please. So here's a little bit more about the request review process. It will be reviewed by an independent committee that is comprised of a representative from ICPSR, a data scientist, a clinical researcher with expertise germane to the data request, a PCORI staff member, and a patient representative. You as the research awardee / data generator will be invited to attend the meetings where the request is for your study's data is being considered. But you will not, if you accept this invitation and want to participate, you will be allowed some input, but will participate as a non-voting participant. The idea here is that while your input and as the representative of the team that generated the data is valuable, we didn't want to have the research team members be in a gatekeeper role with respect to the data. So that's kind of the rationale for that bullet and that policy approach. Next slide, please. So given the nature of some of the research that PCORI funds, which can involve observational data sets, EHR, claims data that are proprietary in some respect, we recognize that the policy needed to articulate some exemptions, the possibility for an exemption based on those types of data, among others. And also, again, if the informed consent to share data has not been attained. Now, from a prospective point of view, we will work closely with you, the awardees who either have just recently begun their PCORI funded projects to ensure that the consent aligns with the policy. The policy also has a backward-looking view to earlier funded projects, and so we work with those awardees as well to look at their consents and see what's permissible. It is incumbent on you, the awardee, to, if you're seeking an exemption, to provide a written explanation to PCORI with supporting documentation to demonstrate why it wouldn't be feasible to comply with all or part of the policy. We'll review these on a case-by-case basis. Again, this will be deliberated between PCORI and you, the awardee and awardee institution. This is not, we'll simply inform ICPSR of our decisions. And so the decisions will be made by an internal PCORI, reviewed and deliberated, adjudicated by an internal PCORI team. Next slide, please. So I think with that, I will turn it over to my colleague, Donna Gentry. Donna, the floor is yours.
Thank you, Jason. Good afternoon or good morning, depending on where you are in the world. I'm Donna Gentry. I'm an Assistant Director of Contract Management here at PCORI, and I'm here to talk a little bit briefly about the contractual issues related to this initiative. For most awardees, you will get a modification to your existing award for the purposes of completing the initiative. They are specific milestones and additional funds that will be added to your project. Next slide, please. These are the basic milestones that are associated with this particular policy. There's a call, there's the data contributor agreement that Jason mentioned. There's the time frame of transferring the data package. These different pieces, these different milestones are incorporated into your project as part of the modification and will be required by the awardees. Next slide, please. And the budget information is limited to personnel costs, which can include consultants. It can include subcontractor personnel. It's the people who will be doing the work that will be allowed to be charged to the project. The total amount requested for this work should not really exceed $75,000, and that's inclusive of the prime and any subcontractor direct and indirect costs. And the salary cap is $200,000, as it says here. That's our general PCORI cap. So those of you you obviously have a PCORI award, so these are general budgetary considerations that you would already have dealt with in your award. But it's a very basic modification. It's really adding milestones and some additional funds in order to get the work done. Some of you, depending on where you are in your project, it could add some additional time, but it's really not intended to do that. It's really intended to work along in the final time frame of your project, somewhat similar to or in alignment with some peer review tasks. So it isn't necessarily going to extend your project, but again, that depends kind of on where you are in your particular project timeline. And what will happen is that after this webinar, we'll begin reaching out to you on a project by project basis to start the modification process for your particular award. And now I think I'm turning it over to Amy. That's pretty much all I have in relation to the contract components.
Thank you, Donna, and thank you, Jason. So I'm here to kick off telling you a little bit about the ICPSR side of the work that we're talking about today. So I want to start by highlighting that PCORI ran a pilot project in planning for this activity back in 2017. We were lucky at ICPSR because we participated in that pilot project. And what that did was allow us to understand more about you as a community of researchers, requirements that you might have around data governance, the kinds of support that's useful for research teams who will be depositing data into the repository, and the kinds of data types that are being collected so that we could plan and outline support for the work that you're doing in the best possible way. So with that, we can move to the next slide, where I'll tell you a little bit about what is unique about the repository, and a little bit maybe about what is common to what we do at ICPSR in general. ICPSR has been around for over 60 years as a domain repository for social and behavioral science data. And with that, we have a robust and long-term historic archive and set of practices for supporting the deposit and curation and access to lots and lots of data sets. We have arrangements with multiple agencies to help those agencies serve their particular communities of researchers so that they too can take advantage of the robust repository services of a place like ICPSR. And really that's what's we've arrived at today with PCORI, is that much of what you'll see and interact with as you go through the process of sharing and depositing your data is common to all the work we're doing at ICPSR. But there are a few novel and unique things that we are doing just for the PCODR repository and as we work with you. So one of the things that is different is that we know that we will be managing data from a very diverse set of clinical studies, primarily observational studies too, but it is a bit different from a general social science data set that comes in. There's a lot in common. People have quantitative data, qualitative data, different kinds of imaging in the PCORI community, but we see many of those same data types in the core social science domains. And so we're able to infer and pivot a bit to support the clinical data that you are all collecting on PCORI. As Jason mentioned, in addition to customizing some of our ingest and curation practices around your data to do it efficiently, we are also using a data contributor agreement and a data use agreement template that really is responsive to the PCORI policy that Jason described, as well as what we learned in the pilot project about the kinds of questions and concerns that research teams had. And then finally, to better support the data that we're getting, we developed a handful of resources and templates and checklists that can help with the standardization of the data so that it comes to the repository pretty well documented and ready for us to ingest into our platform. Obviously, that helps for data use down the road. And so we really appreciate the work that you all are doing with the funding that you are receiving from PCORI to prepare the data responsively to the resources that we'll share with you. And Kirani will be talking much more about the pragmatics of this next. We are also going to, in addition to the data use agreement for anybody who is requesting to use the data sets that are deposited into the repository, going to provide secure access to those data where the data remain at ICPSR at the University of Michigan. We won't be sending the data out to approved users. We'll be holding the microdata in our secure systems. What users will then get will be credentials and access to a virtual data enclave at the University of Michigan. And that access will have stat packages and analytic software that can be used to access the quantitative and qualitative data that are deposited. But in addition to that, there'll be security around that access so that printing and copying and pasting capabilities aren't possible from that window. But what is possible is to request for us to do a review of the output to be sure that any disclosure review standards that we are looking to apply to the data are met. So that's a little bit about that. We will be forming, and what's a little bit different for ICPSR is that we will be working with an external review committee to review requests to use that service, this virtual data enclave service for the PCORI data in the platform. And so we will be managing that, and that will help us vet the scientific merits of those requests, as Jason mentioned. And then finally, we have built into the repository something, again, that's a little bit different from what ICPSR is doing currently and for other agencies, which is additional transparency around the open data ecosystem of the data that are placed into the platform, so that people who are approved to access the data will be posted on our website. So you can see by name who's using the data, and that's built into the data use agreement, so people know that that's coming, as well as those same users are agreeing to allow us to publish a summary of the findings from their work. I think that was my last point. And with that, I can turn it over to Kirani for nuts and bolts on how to get us your data. Thank you.
Thanks, Amy. So as Amy mentioned, I'm going to walk through the nuts and bolts of depositing with PCODR. The first phase is a pre-deposit phase, and Jason and Donna mentioned a bit about this earlier, but prior to depositing, there will be an official kickoff meeting with the PI and the study team where PCORI and ICPSR are also at that meeting to discuss the deposit and preparing the data files. At this meeting, the PI should expect to answer questions regarding the data format, number of variables and observations per file, and also answer some questions such as, are there anticipated components of the full data package that cannot be deposited? Are all variables and values fully labeled? Are there parts of the collection that have confidentiality concerns? And these meetings are largely guided by the checklists for the data deposit and the HIPAA privacy rule checklist as well. The deposit stage begins once the DCA is signed, the DCA that Jason and Amy and Donna mentioned earlier. And now we are going to show you some screenshots of the actual upload of the data set. You will start on the PCODR website on the deposit data page. And here you would click on this deposit data now button. you will be required to create a MyData account under the new user section of the login prompt, which is right here on the screenshot. Once you've created your account and you're logged in, you will use ICPSR's online secure online deposit form. On your screen will be this Create Project pop-up box. PCODR will already be selected for you. And for the project title, you will enter in the formal title of the study and then select No for the question, is this deposit related to an existing ICPSR data collection or series? Once all those are filled in, you would then click on the Save and Apply button. After doing so, you will see another pop-up box, and there will be a link to the PCODR study link, which will say PCODR and a few numbers after that. We suggest that you bookmark this link just so you can come back to the workspace. But on this, at this stage, you would click on the link, which will then take you to the project workspace. And that is what this is what the project workspace will look like. Here, you'll be able to edit the metadata fields and upload your files. As I mentioned before, we suggest you bookmark this page. Once you've edited the metadata and uploaded all the required components of the full data package, you would click on Submit to ICPSR. This is a summary of the deposit instructions I just mentioned. As we said earlier in the presentation, these slides will be sent to you, so you will always have a copy of the instructions, the deposit instructions. So you might be wondering what happens after I deposit my data. So after you submit your data to ICPSR, there is sort of this pre-acceptance phase. The data package will first be reviewed to determine completeness. Staff will contact the depositor about any missing pieces or any questions we might have about the deposit. Once that's been corrected, the data package will be approved as complete by PCODR staff. Next, the data will be curated. The data package would get a study description. The information in the data package may be organized or improved, and the data package undergoes a series of quality checks. Next comes data preservation. Curated data packages are then ingested for long-term preservation, where it is stored in accordance with repository standards. For example, quantitative data files are preserved as ASCII format, along with setup files for statistical software packages, and documentation is preserved using XML and PDF. Then the data are released. So information about the availability of the curated data package is published to the repository catalog. Data packages are then made available in several formats, including SAS, SPSS, and STATA. As mentioned earlier by Jason and Amy, any requests for your data will go through the independent review committee, and secondary users are then required to enter into a restricted data use agreement. On this slide is a screenshot of what a published study page will look like. So here you'll see the title, information about the PIs, and then the persistent identifier. Here, there's a summary of the study, and below on this page will be other metadata information. And on this page is also the access restricted data button, where users would begin their application process for the restricted data. So we've linked some helpful resources here on this slide. As we've already mentioned, the checklist for preparing your data for deposit, the HIPAA privacy rule checklist to help de-identify your data, a roadmap which provides a nice overview of the entire deposit process, and a quick tutorial video of the online tool for depositing data. And that concludes our presentation. We want to thank you all for joining us today, and we hope we provided useful information on the patient-centered outcomes data repository. We've left our email here for you to contact us with any questions, but we